So today we are going to study about mandibular nerve. Mandibular nerve is largest mixed branch of the trigeminal ganglion. Before we study about mandibular nerve, let's see about the trigeminal ganglion. Trigeminal ganglion gives three subdivisions, which are ophthalmic nerve, maxillary nerve and mandibular nerve. Among these three, ophthalmic nerve and maxillary nerve are purely sensory type, whereas the mandibular nerve has both large sensory root and a small motor root as well. Now let's see the figure. This is the trigeminal ganglion. V1 and V2 are ophthalmic nerve and maxillary nerve respectively. The V3 is the mandibular nerve. The sensory root arises from the lateral part of the trigeminal ganglion, whereas the motor root lies deep inside the trigeminal ganglion. It comes out and joins with the sensory root to form the main trunk of the mandibular nerve. This main trunk leaves the cranial cavity through the foramen ovale. Now let's see the main trunk. There are two branches of the main trunk. One is the nervus spinosus and second one is the nerve to lateral medial pterygoid. This nervus spinosus branch goes into the cranium through the foramen spinosum and supplies the dura mater of the body. And the nerve to medial pterygoid, as the name suggests, it supplies the medial pterygoid muscle. It also has a motor root which goes to the otic ganglion here and supplies to two muscles more, which are the tensor palatini and the tensor tympani. Now let's see the anterior trunk and the posterior trunk. Anterior trunk is divided into two parts, one from the motor branch and one is the sensory branch. Motor branch are nothing but the muscular part. That means it supplies the muscles of mastication, which are the masseter, temporalis and the lateral pterygoid. Medial pterygoid is already being supplied by the branch of the main trunk. Now, this is the mesenteric nerve. The two anterior and posterior deep temporal nerves and the nerve to lateral pterygoid. These are all motor type. Now, we'll talk about the buccal nerve, which is the only sensory branch of the anterior division of the mandibular nerve. The buccal nerve supplies the labial aspect of the gums and the teeth and also the cheeks. Now, let's see the posterior trunk. We are going to talk about auricular temporal nerve, the lingual nerve and the inferior alveolar nerve. Now, auricular temporal nerve. Let's see in this figure. Auricular temporal nerve has two roots and those two roots combine to form a single root. Now, the gap between the two roots, from them arises the middle meningeal artery, which again goes into the brain, into the skull, through the foramen spinosum, from where the nervus spinosus branch was also going and supplies the dura mater. Also, as the name suggests, auricular temporal nerve, it has two parts, the auricular part and the temporal part. Auricular part supplies the skin of the tragus, the pinna, auditory meatus, and temporal part gives supplies to the temple of the brain, of the skull. The auricular temporal part also supplies the temporal mandibular joint. Now let's see the lingual nerve. The lingual nerve, as the name suggests, it supplies the tongue, with the anterior two-third part of the tongue and also the floor of the mouth. Now see here. Here is the chorda tympani nerve, which is a branch of facial nerve. This chorda tympani nerve has its fibers with the lingual nerve and supplies the secretomotor part of the submandibular glands and the sublingual glands as well. Now let's see the inferior alveolar nerve. The inferior alveolar nerve is divided into myeloid nerve and the mental nerve and incisive branch. Let's see in this figure. Before going into the mandibular canal through the mandibular foramen, it gives a motor root, a pure motor root, which supplies the mylohyoid muscle and the anterior belly of the digastric muscle. Now, see here. After these teeth-like structure, as these are the ones which supplies the lower teeth. Now, here comes the incisive branch. This is the incisive branch. Incisive branch is the ones which supplies the incisors and the canines. Now, the nerve passing through the mental foramen gives rise to the mental nerve. This mental nerve supplies the skin of the chin and the whole skin as well. Now let's talk about the course. The mandibular nerve arises from the middle cranial fossa and then goes from leaves the cranial cavity through the foramen ovale, reaches the intratemporal fossa as the main trunk, and then divides into the anterior trunk and posterior trunk. Thank you for watching this video. Thank you.